Hi, everybody. My name is Pini Matzner. I'm with Signals Analytics. I'm very happy to be here, even if it's only virtually, giving a presentation in the GFN. And what I'm going to talk about today is how to use advanced analytics for the public good. Basically about how you can use big data to detect pandemics and outbreaks ahead of time. I'm going to turn off my camera to allow more space for the slides, because I think the slides are much more interesting than my face, and I'll probably join in later. So I hope you enjoy my show, and let's start. I'll first talk about Signals Analytics. I'm going to show you who we are and what we do, and then we'll discuss a little bit about the Valley outbreak. I'm going to make sure we're all aligned about this disease, and I'm going to show you how, based on this disease, we created a new concept for monitoring online diseases, and I'm going to compare it to the different systems that are there available online right now. Then I'm going to show you how we put our system to a test, and we're going to end up with some COVID-related information that our system is currently surfacing. Let's first talk about who we are at Signals Analytics. We're an advanced analytics company that was founded 10 years ago by two ex-military intelligence officers who basically brought the mindset of military intelligence into the business world. What we do? We specialize in taking disparate, unstructured, and unconnected data from various sources, basically anything you can think on, and turn it into actionable insights using our next generation advanced analytics platforms. We can provide our customers with current trends and predict with these trends where they should invest if they want to see their product in a specific location in a matter of months or years, and understand where they are and how they should act and react. Basically, we surface actionable intelligence and actionable items out of data. And let's move our focus now to EVAL. EVAL stands for e-cigarette or vaping use associated lung injury. It actually began during last June or July when doctors started to see severe lung damage in young teens that all had in common one thing. They were using electronic cigarettes. And soon after that, scattered cases became dozens of cases. It took not much time before death started appearing and connected to the severe lung damage, and the numbers quickly crossed the 1,000 mark and grew larger and larger. But what it looks like? Well, here's a CT scan of a healthy young female. You can see here her lungs, heart in the middle, the spine at the bottom, which means the front side of her body is upwards in the slide. Now, I'm not a radiologist, but even me can say that there's a difference between this image and this image. This is a CT scan of an EVAL patient. If I were a radiologist, by the way, I could tell you that there's ground glass opacity here in the surroundings, there's pleural effusion, and there's septal thickening. Basically, the lungs are not working. There's a major respiratory failure in EVAL. And what the CDC sees now is that EVALI is an inflammatory lung illness. It was first recognized during April 2019, and the cases peaked towards September 2019. In total in the States, there were almost 3,000 cases and 68 deaths. We now know that the disease was triggered by inhaled substances, and it was mainly vitamin E acetate that was mixed within the liquids that these teens were putting within their electronic cigarettes. At that time, the Foundation for a Smoke-Free World was already a great valued customer of Signals Analytics. And knowing our abilities, they approached us following EVALI and asked us one question. What if we could foresee such an outbreak? Because basically, prior to this death, these vapers were hospitalized for a period of days or weeks. And prior to their hospitalization, they probably went to their doctors days or weeks before, and maybe they were even sensing something, having symptoms, and consulting online with their friends weeks or even months before these things came into the general public's knowledge. Because what happens mainly is that only following hospitalization and death, the health authorities begin gathering information, and this is the only time frame in which news sites and newspapers start showing the cases. it will take further several months until official reports will be published. But again, at least weeks prior to this point, community doctors probably share their information about new cases and interesting symptoms with their peers. They might be doing this on dedicated physicians' social networks, and even weeks or months before that, the actual consumers, they probably share their subjective feelings online. They probably write blog posts, or they probably go online and share a Facebook post or tweet or consult with their friends in various forums because they want to understand whether what they're feeling is unique to them or whether others feel the same and try to understand what they can do. So, of course, we said yes to this amazing challenge, and we first started to see what others did with their online monitoring system. And we realized that most systems are based on two main pillars. One of them is what diseases they're monitoring, what they're tracking, whether it's a specific virus or a family of viruses, such as influenza net in Europe, or whether they're trying to track every known illness to mankind anywhere around the globe, like HealthMap. And the other main pillar is what sources are they using? Are they using peer-reviewed research papers? Are they tracking search trends such as Google Trends or Wikipedia? Or are they going to the actual blog posts and tweets and Facebook posts and see what people are writing? Because there's a huge difference in terms of both accuracy and time sensitivity within these different sources. And here is what we did. Our system is built on a bottom-up approach. We basically monitor several communication types, going from the most granular level all the way back to the top. And this way we can combine different source types. So we have both time-sensitive sources as well as highly accurate sources. And again, our advanced NLP and AI analytics tools, they allow us to normalize these two different data points and combine the two together. So we get lots of strength into the system because we can use all source types. And here's what we actually did. We first created a wide taxonomy that covered the entire vaping ecosystem. Basically anything related to electronic cigarettes or heat-not-burn devices and their consumables, that was covered. And now using that taxonomy, we casted a wide net over any source type we wish to cover, which were social media and news sites, forums, official reports, and peer-reviewed papers. We basically gathered anything with that taxonomy. And now we've run it through a relevancy test because I just told you that we're covering the vaping ecosystem, but I don't want anything with water vapor or vapor rub, for example. So we removed all out of scope data points. And now that we finally have all the relevant data points from the entire source types that we covered, we use our advanced algorithms and intelligent data refinement tools to normalize and classify everything according to the unique context of the source type and what was actually written within the data. So if someone mentioned an adverse reaction or a medical condition or a brand name of a specific product, we had it classified. And using that data, we could finally raise alert. So if a specific adverse reaction accumulated over time or a medical condition was referred too many times, we could raise an alert based on the normalized and classified data. And now we finally had the system, and it was time to put it to a test. So we started by gathering all data from 2019. And here you can see the trends and the volume, and of course, the peak of Valley during September. But first, we needed to make sure that we're on the right track. So we split the data to data that's coming from social posts and data that's coming from news posts. And we found great correlation between these two and the ongoing cases of Valley. So we knew that our relevancy and classification works well because we only let relevant information in and we cover it according to what really happens in the world. So Valley was too easy to test, and we decided to go with something much harder. And we recognized this thing in April. It's basically a statement from the FDA on an ongoing scientific investigation that was related to seizures following the use of electronic cigarettes. And then we decided to do something like this. I remember our methodology. Things came weeks or months prior to the actual event. So we started collecting data beginning January 2018 because we were looking at an event that was published during April 2019. And now you're only seeing the data that went through relevancy and that had any sort of classification that related to any adverse reaction. And when we break it to the different adverse reaction groups, and I remind you we're dealing here with vapors, you can see that the main symptoms that dominate this ecosystem are the general symptoms, headache and fever, followed by respiratory issues, coughing and difficulty breathing. But there's a huge peak there in a red line, and that red line is talking about what we define as skeletal muscle, and the adverse reaction seizures is hiding right inside this. So now you only see posts from January 2018 all the way till the end of 2019 that has seizures classified within them. And we went as back as we could and we recognized this change of trend. And then we went to the actual data, and what we surfaced was actual posts coming from social networks about kids that had seizures due to them vaping synthetic marijuana, or someone who had a seizure on a Magic Puff, a specific brand related to K2, which is synthetic CBD, or someone that had ordered some kind of K2 e-liquid online, and once we all started vaping it, they had intense seizures. Now, this is February and March 2018. Only half a year later, the FDA stated that there might be something regarding contaminated illegal synthetic CBD products. And again, only a year following these posts, the actual FDA statement came forward. So you can see now at a whole that our system raised these early signals, early alerts, a year prior to the official statement. And not only raised the alert, we were able to pinpoint the exact cause because we connected between vaping, seizures, but we connected between vaping synthetic CBD and seizures. So this really made us very happy. And now that we were sure that the system works well, we put it to actual work, and it's online since January. It actually went live and it gathers information and alerts ever since. And what was interesting is that we started seeing COVID-19 related alerts coming through the system, but I just told you that we have strict relevancy rules, so this shouldn't have happened. And we examined, we've seen that the symptoms of EVALI have lots in common with the symptoms of COVID-19. So basically, our system now tracks posts of COVID-19 within the vaping ecosystem. And when you try to break these into the different topics that are being discussed, you can find very interesting information, such as the self-reporting of symptoms and location. Here's a 39-year-old female that talks about the ongoing onset of her disease and the places she's visited, several stores or a specific restaurant in downtown Dallas. And you can also see that she feels a certain symptom. Her eyes are swollen. This came way before red eyes became an issue with COVID. You can also see people that are not having COVID, they have different illnesses, avoiding going to the doctors or getting medical aid because they're afraid of catching the virus at the different places they'll go. So now we know that there's a collateral damage of other illnesses that might get worse. We can also see conspiracy theories and disbelief. Some people actually believe that there was never a valley, that was COVID all along, beginning in October and November in the States. So we can guide the health authorities with better messages to the public if you really want them to keep their social distancing or using masks. Now, there's huge amount of valuable information regarding COVID in such a system. And if a system dedicated to COVID will be built, we can even do better because we can surface chatter about symptoms that are currently not connected with the disease. We can find behavioral patterns, whether people are keeping their social distancing, if they're feeling symptomatic but they were not positively tested, or we can identify potential danger locations, just like the one I just showed you. And just to end my presentation, I think the big data era is nice, but what makes it amazing is that we are really in the era of analytics. And gathering the data, as I showed you, that's easy, relatively. Surfacing the early signals, this is what takes us to the next level. So I hope you now believe that advanced smart monitoring of online discussions, it allows prior identification of potential outbreaks, and it has a lot to give us in terms of outbreaks and diseases. So I hope you enjoyed my presentation, and I wish you all just great and amazing continuation of this conference. And goodbye to you all.